Meeting to order for the month of November. Rebecca, can we do a roll call?
Sure. Mr. Joyce?
Present.
Reedy's excused. Mr. Beston?
Here.
Collins?
Here.
McLean Lane is excused. Miller?
Here.
Moriello is excused. Mr. Ward? And Willingham is excused. 5 present, Mr. Chairman. And also, if I could just briefly make a statement. This committee is not a public forum, so there should be no communication, no questions asked of legislators or persons appearing before the committee, and no questions asked of any spectators, just as a reminder.
Thank you, Rebecca. Can I get a motion to approve the previous meeting minutes? Motion made by Mr. Besson, second by Mr. Ward. All in favor?
Aye.
Any opposed? Unanimous. Under current business, what I'm going to do is, because we have mental health number 2 and it looks like number 6, I'm going to take number 2 out of order, move it to the end, and to take care of the Department of Health first with item number 3. So with the, there we go. Number 3, authorizing an agreement with the New York State Department of Health regarding the indoor radon grant program. Good evening.
Hi. Mary Beth Miller,
Yep.
the Deputy Health
Sorry, Mary
Commissioner.
Beth.
So the Radon grant is a grant we've had for a number of years, and we're just looking to renew it for $50,000. We subcontract with Cornell Cooperative Extension and do a lot of outreach and education related to reduction of the health effects of radon and educating on the importance of reducing radon exposure.
Okay. Any questions from the committee?
Motion.
We have a motion by Mr. Ward, second by Mr. Beston. All in favor?
Aye.
Any opposed? Unanimous. Excuse me. Number 4, amending the 2022 Health Department budget, COVID-19 and monkeypox response funding.
We're looking to move some funding into our per diem line. We have had a 30% vacancy rate in the department, and to be able to do some of the monkeypox work and COVID work, we've been able to get per diem staff on, but we need to have enough money to pay them through the end of the year, so we're looking to just move those funds.
Do we have any questions from the committee? Motion made by Mr. Ward, second by Mr. Collins. All in favor?
Aye.
Any opposed? Unanimous. Number 5, amending resolution number 252 for 2021 regarding COVID-19 testing in K through 12 schools in Albany County.
And this is basically a no-cost extension to renew a contract with Quadrant Biosciences to be able to continue to offer testing at the schools. There are a few schools in Albany County that are continuing to do testing, and this allows them to do that.
Thank you.
I have one question.
Mr. Miller?
Do you know how many schools are still doing that? Do you have an
There's-
idea?
Yeah, there's about, I believe, 3 school districts that are still
That
doing
are
that.
still doing it? Okay, thank you.
Which school districts are those, by the way, just so we...
I don't have that
That's okay,
particular,
just curious.
I know Guilderland is one of them, if that helps, but I don't know the other 2 off the top of my head, but I can get that info.
Yeah, I was just surprised to hear some are still doing it. so.
Yeah.
Yeah. Can we get a motion from the committee? Motion by Mr. Besson, second by Mr. Miller. All in favor?
Aye.
Any opposed? Unanimous.
Thank you so much.
Thank you. Okay, we'll move on to our mental health department. Juliana, if you want to join us. Good evening. Number 6, authorizing an agreement with Information Management Associates regarding patient and billing software at the Department of Mental Health.
Good evening, Mr. Chairman. Thank you very much. This is this is an annual renewal of our electronic health record and billing system with IMA, and come before you in previous years for these renewals. We've been working with this this company for the last 30 years. It connects all of our sites and does our billing for us as well. As part of our clinic redesign a few years ago, we upgraded the system to web-based and allows remote access for our clinicians And we're very happy with this product. And quite significantly is that we have 30 years of legacy records. We have patients that we started seeing as children, we still see them as adults, some of their family members. When we have in the past looked at other vendors, it was always a question as to whether they could provide us a software package that was both a billing product and an electronic health record. And it was always a question as to what would happen to our legacy records. With this company, we don't have any questions at all on either of those products, either of those options. So we ask you to approve our renewal.
Thank you. Any questions from the committee? Hearing none, can we get a motion to move? Motion made by Mr. Collins, second by Mr. Ward, all in favor?
Aye.
Any opposed? Number 7, amending the 2022 Department of Mental Health budget year-end adjustments.
So yes, Mr. Chairman, in fact, that is what this is. This is a year-end adjustment to move money from lines that over the course of the year were not filled for various parts of the year, and to fill these negative lines in insurance, inpatient hospitalization, and the quality assurance coordinator position.
Dr. Giordano, any questions from the committee? Hearing none, can we get a motion to move? Motion made by Mr. Best and second by Mr. Collins, all in favor?
Aye.
Any opposed? Unanimous. Number 8, authorizing an agreement with the New York State Office of Mental Health regarding mobile crisis unit funding and amending the 2022 Department of Mental Health budget.
Yes, so as you all know, we have a mobile crisis team. We were one of the first in the state. We've been operational for 30-plus years, 24/7. And in the last 3 years or so, the state has moved to Medicaid the service, which means we can now bill for crisis services when we couldn't in the past. And the state has offered this opportunity to all the mobile crisis teams across the state, $50,000 award for training, technology enhancements, and billing efficiencies. So we're asking your permission to accept that grant.
Uh,
Any questions from the committee?
Just one quick one.
Go ahead, Mr. Miller.
Just in general with the mobile crisis unit, just a general question. Does this deal with people of all ages, or is this adults?
Right, so our mental health mobile crisis team is for adults only. The Northern Rivers program locally does the children's mobile crisis team.
Okay.
And that reflects the difference of our departments. Years ago, the Department of Children, Youth, and Families took the children's mental health piece, so it's not really under our purview any longer.
Okay.
However, we do see children as a backup when the Northern Rivers team is not available.
You know, that's an important point. We operate hours that they don't.
Okay, thank you.
Thank you.
Any
I'll
other
make a
question?
motion. Oh, there's another question. If there's no questions, I'll make a motion.
Oh, okay. Any other questions? You have a motion from Mr. Miller, second by Mr. Ward, all in favor?
Aye.
Any opposed? Unanimous. Number 9, amending resolution number 421 for 2021 regarding residential and treatment services and amending the 2022 Department of Mental Health budget.
So you see me every year come to you with our 100% state-funded provider contract for OASIS and OMH. Over the course of the year, there are adjustments made at the state level which require us to come to you to adjust the budget. This is for the Hope House program. It's a cost of living increase that the state has passed down to us, and we're asking permission to request to add that to our budget so that we could pass it on to the program.
Any questions from the committee? Do we have a motion from Mr. Peston, second by Mr. Ward, all in favor?
Aye.
Any opposed? Unanimous. Moving back to number 2. Number 2, authorizing agreements with Genoa Healthcare LLC regarding pharmacy services and lease space at 260 South Pearl Street in the city of Albany. Most on this committee are familiar. Obviously, you've been talking about this since at least September, usually approving it back in 2019. So we were all here in the county courthouse on Monday night. There's quite a bit of debate on this. First, I'll take any questions from the committee about this contract, and then we'll move on to any non-committee members of the legislature.
And could I just make 2 notes?
Yep.
Really quick? This did pass favorably out of law last night, but also second, there was a request from legislators to have language included in any potential resolution pending that favorable recommendation, where it would not allow it would exclude the do not compete language from any further contract. So that would be conditional essentially on that. So approval would be conditional on removal of the do not compete language, which I believe has already been discussed with Genoa anyway.
Correct.
Yes, thank you.
Okay, thanks, Rebecca. Do we have any questions from the committee? No questions?
May I, at the meeting the other night, there was a legislator who's an attorney, made a comment that she thought that and she's not here tonight, right, that's for myself, but she made a comment that she thought that the contract, or the new contract, would not be legal with the, not to compete clause in it.
The county attorney's office is here tonight.
That's why I wanted to get, I wanted to hear from your words.
Okay, so, I'm sorry, what was it?
Whether the do not compete clause is enforceable or not.
Well, it's enforceable to the extent that it was agreed upon by the parties when the contract was initially drafted and negotiated. It does have some consideration to it in the sense of the fit-out was paid for by Genoa to fit the space, to get their approvals, and there also was no declining rent deduction. So that was the consideration for the agreement. Whether it's enforceable or not, our intent is, should this pass and go and be renewed, is to not have that language in there at all. And that's been discussed as a precursor. But the idea would be if at the end of the 2-year extension, there would be then, it would essentially be a situation where it would, if the program is going to be continued, it would go out for RFP to a new vendor, and out it would go, and who knows, Genoa could do it again, or another pharmacy could come in and put a proposal in there.
I think the question needed to be clarified was, does the do not compete clause expire with the existing contract?
No, it does not.
Oh, okay, that's what I just wanted to clarify.
It doesn't.
Any other questions from the committee?
No, I just, if I could just, I put a question at the end of it, but part of a statement. So I wasn't able to make it last night, but I did watch online. I had a lot of questions. I appreciate you guys' time. Spending that time last night, it was a long meeting. Maybe in the future, when we have something like this, we could try to do a joint meeting so everybody can hear it one time.
It was just timing wise because it
was
got
very
sent back on
late,
Monday.
right, it was quick. Just to go back to that same point, for me, it's never been about one pharmacy versus another, whether or not this is a good program, because it sounds like it is. It's been about, how this contract was written, what it did to the legislature, and whether it bound our hands or not, okay? So the intent, again, is what I'm hearing from last night, I watched the meeting, was the intent is to have that out, but Genoa does not have to agree to that, correct? When, in the renewal, that could that become a fight with Genoa?
It could. Sure.
Right, okay.
Absolutely.
Thank you.
But just as a point of clarification, if your resolution mirrors the one from last night, if it doesn't come out, it has to come back to this committee, because at that point, the resolution is not effective. So if your resolution has that caveat that Rebecca mentioned, it's got to go, hopefully the negotiation skills of the county attorney's office, which I'm sure are pretty good, will make it happen, but if not, it would have to come back here.
Which resolution you talking about? The new one that would come up next time?
That we discussed last night was that law had asked that we make the language conditional.
Right.
Essentially, if you approve it, it goes forward if the do not compete language comes out of the contract. Otherwise,
Right.
it comes back.
But when you say resolution, you're talking about what we vote
What
on
we would
in
write
general,
at the
in the
next
general
meeting.
meeting. Oh, right.
Please, no one does it.
Yep, got it.
Perfect, thank Any other questions from the committee? We're just gonna- general contract.
Can you wrap it up with the questions? What you were just asking about that note with heat? You just won't go in again.
No. If it's worded properly. Any other questions from the committee? Hearing none, do we have any other questions from any other member of the legislature? Let's see, go first.
You can go.
Go ahead, Mr. Fine.
Thank you, Mr. Chairman. My question, Dr. Giordano, so during our legislative forum, during the public comment period, Dr. Ordway spoke about adherence, and she spoke about different measures that can be used, such as how the length of time can change the data, and I'm wondering what the parameters are for the adherence data that the mental health clinic currently has, and how these parameters were set.
I don't have the answer to that.
So do you, like for the Genoa numbers, you don't know the parameters of how they,
I do not.
okay.
But to clarify, Dr. Giordano, you indicated last night that the data only is during that general period because no other
Correct.
people, pharmacies give you that data. So it could
Correct.
only be during this 3-year period.
Right, the time parameters, correct. I don't, the measures are, whether they pick up the medication and for injection, whether they take the medication.
They're snapshots in time, though, so, basically at any one given time, there's a snapshot as to what the compliance rate is at that moment collectively. So if you were to take it a year ago, it would be one thing, if you take it 6 months, it's another thing. But overall, when you average it out, it's that what we've provided.
That number that was
It's close to 90%.
It's close to 90, that's
Yeah.
overall since
Yeah,
they've come in?
Yes, yes.
For
that
that,
time period.
for that.
For the
those-
time period that Genoa has been,
And only for those patients that are being served by that.
right. So that's the time period that we're talking about.
Yes. Yeah, I guess, one thought is just that, I understand Genoa has a good compliance rate, and the patients seeing Genoa are getting good service. And, I trust your, expert opinion on that. But that's also only a very small percentage of the patients that go to the mental health clinic, 16% or so. So, I mean, have you looked at potentially better models of care that, spoken with, consulted with pharmacy experts like Albany College of Pharmacy, or, looked at other models that may, other ways to get, compliance to increase for all of the members of the clinic?
I think
rather
the
than
county's
just a
open to
subsidy?
any measure that will increase compliance I'm not sure what that has to do with this, but if you're saying that you want the county to do more to increase compliance among those who are mentally ill and being served by the Albany County Department of Mental Health, we're 100% in favor of that, but that doesn't necessarily apply to this contract.
Well, I'm wondering when the RFP was put out, if, other
This was a
options
measure
were
to do that,
considered.
and it's worked. If there's ways for the other folks that don't go to Genoa, and you have an idea to do that, we're in favor of that. But
Okay, well, we'll maybe have some discussions about potential other ideas at a.
Great,
another
sounds
time.
good.
Separately, though, we've always had other pharmacy groups come in, like I'm forgetting the exact name of it, but the consortium, they've come and spoken at many of our meetings. We certainly have had patients from our department be a part of some of those. So in no way does this alter our ability to have patients from our department utilize other programs that they might benefit from. That's always been the case. Now, that's not to say we're aware or familiar of every single program, but the ones we are aware of, we've invited to various meetings, and they have come and spoken to us, and we do utilize some of those programs.
Okay, thank you.
Any follow-up, Mr. Fine, or are you good? for now?
I'm good.
Okay, thank you. Chairman Joyce?
Thank you again, Dr. Giordano, for being here. One question that was asked last night, I didn't hear it asked tonight. I kind of want to steer the conversation back to healthcare. And two questions. Number one, if we don't approve this measure this month, will Genoa be ceasing operations at that site at the Department of Mental Health?
I think they're bound, I'm sorry, but
Well, sure, it's sort of bound up in a legal question. The lease would expire, the service contract would expire there are certain parameters that we have to work within. You can't just shut down a pharmacy immediately and have it closed the next day. There are rules with the Department of Health that need to be followed. So essentially, in the short term, if we were not to go forward, we would serve General with a notice of intent and have them to vacate as soon as they could under the state regulations to close up the pharmacy. So it would be anywhere from 30 days to 60 days to maybe 90 days, but it would be a month-to-month type thing, and it would end upon our asking them to vacate.
Okay, so my follow-up to that, once we don't approve this contract and we tell them to vacate, that will impede services at that site for individuals who need it, and that will place people in harm's way, correct?
I believe so, but I think that as council has said, there is an obligation of any healthcare provider to arrange for other methods to serve them. So we would have to go case by case, working with the pharmacy to make sure people's needs were met. But in the moment, it would definitely disrupt the service.
Thank you.
Thank you, Chairman. Ms. Willingham first, and I'll get Mr. Collins.
How long would it take if this was voted down? And how long would it take for the patients and to get to their next, the dosages that they need? How long would that take? And who informs them? How long is that process?
Well, first let me say those are the right questions. Since I've never been through a termination of a pharmacy, I don't know the answer. We would work diligently to make it happen quickly. People can take their prescriptions to any pharmacy they want, and we would instruct them on how to do that. So it's really just a question of making sure that each and every of those patients was taken care of. So I don't know the timeframe it would.
So when each time they come in, I really want to stay here because each time they come in, are they bringing a prescription? Or they're going someplace where they already know their prescription? Just like if I go to my pharmacy, I don't have to bring a prescription every time. They know that that's where I get my.
We do electronics
Okay,
prescribing.
so then if they come, how often are they given this medicine?
Oh, it varies. We have 1,000 patients in total, and each one of them has a different medication regimen. Some are monthly, some are 90 days, some are.
Oh, okay.
And they have refills, they also have refills on them, so sometimes they don't always need something called in by the prescriber because there's a refill already for them.
So do they know where else to go?
We would have no issue informing them, and that I think would be our obligation. But, one of the things we mentioned last night, 75% of all of the prescriptions filled for our patients are outside of the Genoa Lincoln group. So people are going all over the county now to dozens of other pharmacies. And we would continue to steer people, to let them know that CVS is there, Lincoln's there, Walmart's, that information is, we would make sure that they knew that there are other pharmacies.
And they could choose whichever one they wanted
Yeah.
that best met their needs.
So there's 1,000, but you said only 100 and what?
160 in the last year have been attached to Genoa.
And for clarification, those are the injectables, right?
Not all of them at all. There's a subset of that subset that are injectable.
Okay, yeah, correct, yeah.
Mr. Chairman, from a timeline perspective, I just recall last night, one of the legislators put in, if and this goes to the chairman's questions, if the contract was terminated, there's a question that it would be anywhere between like 8 months to 2 years, depending on the non-compete and the time it would take to transition everybody off and potentially get in a new provider. But of course, if that was challenged, we couldn't get in a new provider, then it would be the 2 years, and then it would restart in terms of services at the Department of Mental Health. So there's a question that remains about the time period, but you could generally say from 8 months to 2 years.
Did you have a follow-up, Ms. Willingham?
Yes, and based on what you just said, so there would be a new bid?
Yeah, so like any other,
But in,
so in 2 years, well, we would do it before that, because like any contract, you would rebid before, so that once it expires, you are either, the new contractor is ready to start when the old one stops. And that new contractor may be the same or different.
Thank you, Mr. McDonough, McLaughlin. Mr. Collins,
No, my questions are covered, thank you.
do we have any other questions from any member of the legislature? Hearing none, can we get a motion to move?
I'd like to move, a motion to move this out of committee with no recommendation.
We have a motion to move this out with no recommendation. Do we have a second?
And is that with the proposed language as
With- yes,
discussed
yes,
last night?
I'm sorry, but yes. With that caveat.
What you said, I'll second.
Seconded by Mr. Ward. All in favor?
Aye.
aye.
Any opposed? It's unanimous. Can I get a motion to adjourn? Mr. Bessent, second by Mr. Ward.
Thank you, Mr. Chairman.
Thank you.
Thank you.